afternoon, everyone, and thank you. First of all, I'd like to thank the organizers for giving me this opportunity to kind of share, well, not just my perspective, but I suppose the medical professionals' perspective. So let me just share my screen. Right. So, in order to kind of share with you sort of my perspective, a neurologist perspective, part of it is also to actually kind of talk to you about what the disease is, because for me to be able to talk to patients, one needs to really have an idea of what is MND and how do we explain that to you so that you understand where we're also coming from, so that hopefully together we can kind of try and do what we can to support you as we go along. Okay, so the overview of my talk today. So what I am going to do is just talk to you briefly about what MND is, what happens in MND, how to recognize the signs of MND, what are the types of MND, and how does one manage MND. And then I'm just briefly going to share with you perspective from my perspective, that is from a personal perspective as well, from my experience with speaking to patients, caring for patients and their caregivers. And also I had an opportunity to speak to a couple of patients recently just to ask them about, what sort of things they would want to hear from me. And I'm just going to share with you what they said today as well. So first of all, I think, the question is who is affected in MND? And I think it's important to know that, this is a condition where, there wasn't anything that you did wrong, or was there anything in your lifestyle that was wrong? So it's a little, it's very different than the majority of patients that have strokes, the majority of patients that have heart attacks, that can sometimes be linked back to the fact that they've got hypertension that was poorly controlled. But with MND, anyone can be affected, any one of us. And typically it does occur in adults and tends to be sort of middle age. That's what we tend to see over the age of 50 roughly. But to be honest, it can happen at any age and it can happen at any time during your life. And what is it that happens in MND? So I'm going to try and keep this as simple as possible. I think many of you maybe already know this, but essentially, this is just a little cartoon that shows you. So the motor neurons are like the wiring that's in your body, okay? And you've got your face and tongue muscles, you've got your arm muscles, you've got your chest muscles, you've got your leg muscles, and the brain is like the command center. And it connects us to all the muscles in our body, and it receives input as well as to our sensation, for instance. So when we talk about MND, we're talking about the nerves that speak to our muscles, okay? And what happens in MND is that as time goes by, the nerve stops sending messages to the muscles, and therefore you get problems with how you walk, how you talk, how you eat, and also how you breathe. This is some of the features that we can see. And sometimes we also do recognize in some patients, it also affects how you think and how you behave as well. So why does this happen? So in 10% of patients, it does run in families. So there is actually a problem with the gene that is passed down through generation. But in 90%, there is no clear reason. And that is, the majority of patients, we don't know why. But maybe a few factors, when you combine them together, it increases your risk of MND. And it requires several steps, to have those various factors be part of this, a whole thing that then tips the balance, and that's what triggers someone who was born completely normal, was completely okay, you know, when they were a kid, they were okay in early adulthood, and then suddenly the nerve starts to sort of slowly lose that ability to speak to the muscles. So I'm just showing here, you know, a little balance that says, you know, these are some of the factors that we think might be playing a part. So as I've said, so it's several steps. So these are in relation to patients that have got a family history or patients who carry genes that we know are affected in MND. So these are three of the most common genes. And when you have that gene, the number of steps that require you to go on to develop MND, because it's not absolutely 100%, okay? So you still need some of the trigger, some of the factor that is triggering to make the nerve start to kind of like stop speaking to the muscles. Okay, so these are, you know, a few steps for this gene, a bit more step for this gene, and a bit more step for this gene. But this is the one that we, you know, the majority of our patient comes under this category, where they don't have a family history. We do not identify any particular gene per se, but they do develop MND. So what are those steps? You know, there are up to between 5 to 6 steps for those patients. So we do feel that it is likely that you do carry this gene, but this gene on its own will not do anything much. But it may increase your risk of developing MND if you add several factors, okay? So when we talk about environmental factors, some of the factors may be smoking, certain chemicals. There is some suggestion that maybe previous head trauma or head injury, certain infections, the age as you get older, and also, you know, we've talked about physical activity, for instance. You know, people who are super fit tend to kind of be a bit more predisposed. So all of that together kind of tips the balance and trigger you developing the condition. So when that happens, what is it that actually happens to the MND nerves itself, okay? So this is a very complicated diagram, and I'm not going to kind of like go through this in great detail, but I just wanted you to have an idea because then you will understand why, you know, we're having such difficulties finding a cure. So this is what the nerve looks, but this is a very, you know, amplified version of this, okay? So we've got, this is the wiring that I was talking about. So this is the wiring, and outside you've got, you know, the sheath around the wiring, that's inner wiring. And then sometimes what can happen is that this particular structure is not secure. And then you've got, you know, things like you see pathways here. So that's all kind of transportation. So the transportation system might go off. The signals that you're telling, you know, your cells to work, that might not be working so well. Sometimes you get too much of the ones that is making your nerve too excitable. So sometimes, you know, part of, like with anything, we have waste byproducts. So sometimes you have too much of that. And sometimes the actual battery, so this is the battery within our cells that make energy, that allows us to do what we do. So sometimes there's a problem with that particular battery. And then our nerves sits in like a support system. So sometimes that support system fails. And also nerves, like us, also need food, nutrients. So sometimes that is also not enough. So all of this are contributing to why the nerve starts to shrink, why the nerve stops talking to the muscles. So is MND common? It is not as common as stroke or Parkinson's disease. So if you look at, you know, the Western countries where they really capture as many and probably most of the MND patients in the country, they do believe that there is 1 in 300 lifetime risk of developing MND. So it's not as common as Parkinson's disease, where it's about 1 in 30, but it is still evident. So if we're looking at what we understand about what's happening in other countries where they are capturing most of their patients, new cases is probably about 20 to 30 per million of the population. So if in Malaysia we're working at roughly about 30 million, you would see new MND cases about 1,000, in a year. But at any one time, you would have between 50 to 80 per million living with MND. So in Malaysia, for our population, we should see more than 2,000 patients living with motor neuron disease. But certainly we are seeing, and those of you who have been to UMMC will know that, we do have a dedicated group of people looking after patients with MND. We're seeing maybe 25% of this number. And we think it's because they are being missed, and that's the reason why we're not capturing the patients. So in order to do that, we need to understand, what are the signs that you get with MND. And this is something that patients need to understand, the public needs to understand, the whole health community needs to understand. So the key thing about MND, it is a neurological problem, okay? So it is a nerve to muscle problem. And what happens is that you start developing a weakness and it progressively gets worse. And it tends to be painless. So you may get pain as a result because of, the fact that you haven't moved your arms for a long period of time. But when you have the onset, you don't have pain because the sensation, the pain nerves, the pain wiring are not the ones that are typically affected, okay? So progressive painless weakness. And how progressive is variable, it changes between one person to the other. But when it does become weak, it can affect the head and neck muscles. So you might have problems with your speech, speaking, swallowing. You might find that the saliva is pulling quite a bit because you're not able to swallow as much. You might have breathing problems. So you might feel quite breathless. You might find that, your breathing is quite restricted. And you find that sleeping is a problem, especially when you lie down. Suddenly you find that, you just cannot breathe when you lie down. In the upper body, you might find that your hand becomes weak. You might find that, how you want to do things becomes a bit limited. You might find that, your muscle starts twitching for no reason. You might have spasms, problems with dressing, handwriting becomes difficult, using your hands to do things become difficult. And in the lower limbs, you might find that you tend to trip a bit more because the foot is not clearing the floor, for instance. And you might find it difficult going upstairs, for instance. So these are some of the signs and the symptoms that a patient might present with. And I think, whoever, even in the public and also certainly in healthcare, any healthcare professionals, because you might go to the doctors. So it's really recognizing these symptoms, because when it comes to neurology, it is a little bit complicated. It's not like with heart attack, everybody knows you get a chest pain. With MND, the symptoms are not that straightforward. So I think that's one of the reasons why we're not maybe seeing as many as we should do. So as I said before, is every MND patient the same? Well, they are not. Each person has their own pattern of disease, and they also have, their own speed at which the condition progresses or maybe stops for a while. All of these are things that is very, very difficult to, for me to say for sure, which is why, these are some of the kind of subtypes that we have, patients who might start off with weakness in the arms or the legs first, patients that might start off with weakness in the speech and swallowing muscles, patients who might have weakness throughout, but they don't have the stiffness that comes with it. Or patients that might have a lot of spasticity and stiffness, but not much weakness. So the pattern is different. So every time I see a patient, I always tell them that, it's very difficult for me to say exactly what's going to happen. So it is best to just take things one step at a time, because each person is different. And, their experience is also very different. So how do we diagnose MND? Okay, and how would you, just for your knowledge as well, how do doctors diagnose MND? So I think first and foremost, in Malaysia, it can be quite challenging. Maybe not in Kuala Lumpur or Klang Valley, but certainly outside of this region, the number of neurologists are not that many. So the whole of Malaysia, I was just telling the healthcare professionals this morning, the whole of Malaysia, I'm told, has about 107 neurologists. I mean, we're a 30 million population, so you can imagine the ratio is very poor. So that's one thing. And then the other thing is, unfortunately, the majority of them are in Klang Valley. And also some of them are also in the private sector, which means they may not see everybody. So whatever it is, doctors as a whole, I think, should just be aware of these features. And if they do see patients, they may do the following. They will go through your story. So we call this history. So they go through the story of how things have started. And what we're looking out for is that when it started, it usually starts at one place, and then it will start to progress to a different place. It doesn't happen just like that. Suddenly you become weak on one side. When something happens suddenly, that's typical of something like stroke, for instance. So when the neurology symptoms, the weakness starts, and it continues to progress and gets worse. So that suggests that it's not going to be something like stroke, for instance. And then we would look for signs. We're looking for signs that suggest that connection from the brain and spine to your muscle is affected, and from the nerve after they've come out from the spine is also affected. So that's what we call, if you read the literature, you might hear upper motor neuron. So upper motor neuron means that it's coming from the brain and the spine. Lower motor neuron means it's the wiring after it has left the spinal cord. So we might do, if the resource is available in the doctor center, we might do nerve and muscle tests. And there are lots of other tests that is available, but is not available in every center. And of course, there are things that can look like MND. So one of our responsibilities is that the doctors will do a lot of other things to make sure that we're not missing other possible diagnoses as well. And we also need to follow up, ideally, because we need to see. I mean, I couldn't tell you for sure what is going to happen until I've seen you, to see that, yes, we are seeing the pattern that is the same, and we are seeing that there is some progression as opposed to something that's just happened just at that point. So I think as doctors, we try to sort of keep an open mind before really decide, sharing with you that what we think is likely going on is MND. So can you predict the speed? It is not always clear. There are tools that can help, and I think those of you who do attend my clinic will realize that there are sets of questions that I ask, and this actually is something that is universally applied. That means everybody around the world also uses the same scale. And what it does is it looks at your function. It looks at your function, the function of your muscles that control your talking, your eating, your hand movements, so your writing, your ability to use, knife or fork or spoon or chopsticks even, body movements, how you turn, how you dress, how you walk, how you climb stairs, and also questions relating specifically to your breathing pattern. And with this, we are able to kind of figure out what is going on, and it doesn't have to be everything affected. Sometimes one particular area is more involved than other particular areas. So as I've said, each patient, it's a little bit different. So we try and look to see where are the areas that we need to focus on. And why is it important to check? So the reason is that, we want to see, is there anything that we can do to help you cope with your illness? And the earlier we can detect these issues, the more prepared you can be as well. And also we can be in terms of trying to see what is it that we can try to do to help. I mean, I appreciate that sometimes, we may not be able to help, but we do, try to see if possible, there's something that we can do. So this brings me to the fact that, I think many of you will know that at the moment, fortunately, there is no cure. But whilst the search continues for a cure, we are looking at ways of how we want to slow down the disease progression, how we can improve your quality of life. So I'm going to start off by talking about something that we do certainly at our center, because we're living in Malaysia. We are not a high income country. We have a lot of other conditions that are so much more common. So you can understand that a lot of the health resource is actually going to treating a lot of other conditions. So drugs that have been shown to perhaps slow disease progression in MND is not something that is readily available in Malaysia in our local context. So we have focused on the caring for MND patients, and there is good evidence to suggest that having a multidisciplinary care where we involve several different specialties that bring different input and try and put the patient and the carer at the focus of our care. So this may involve someone like myself, who's a neurologist, my colleagues, palliative care, and also the rehab physicians. So these are probably my closest collaborators, part of the team. And then under the rehab, you will have your physio, your occupational, your speech therapist. And then there may be a situation where we might need to involve the gastroenterologist, the dietitian, chest physicians, anesthetists, and also the nursing staff that also deliver the care. And, there is evidence that suggests that having that multidisciplinary, multi-team care versus just going to see one person, that does improve your quality of life, improve the survival, and also in terms of convenience, that's we really want to try and see how we can make things better within our capabilities, to try and improve that access to all the different specialties that you do require. So are there any drugs, you will ask? Well, there are two drugs, okay? So there is riluzole and there's also edaravone, which is something that is more recent. Riluzole has been around for almost more than 20 years. So this has been shown to improve survival and also time to when one needs breathing support. In the original study, this was by 3 months. But subsequently, we think likely to be longer, but also we're talking about months. Edaravone is something that you give through a drip, so it does require you being admitted to hospital, certainly in Malaysia. And when you give it at early stages, when patients do not have a significant degree of weakness, then it can slow, the loss of that function, okay? But unfortunately, both treatment is very expensive, and at the end of the day, they do not cure. So it's not something that, we do leave it up to patients to decide, is this something they want, or would they prefer not to try the treatment? I mean, there isn't a right or wrong here. I think at the end of the day, it really is up to the individual. So I know, because this is PALS and CALS, that everybody will be wanting to know about stem cell therapy. And I think it's really important for me to just kind of clarify certain things, because I think there are, unfortunately, a lot of, sort of stem cell clinics, companies out there that are, telling you that stem cell work. So I have to come to you from a scientific basis, okay? And there is currently no good evidence that it really works, not in the context of motor neuron disease. So what are stem cells? So stem cells are basically our cells that are our raw material. And what they can do, what's special about them is that they can actually grow to become different cells. So they can become nerve cells, liver cells, blood cells, cardiac cells. And, so you can understand why it is definitely worth looking into this as a therapy, because what you want to do, if your nerves are failing, you want to have a capacity where you can, produce cells, new cells, correct? But the thing is, it's not that straightforward. And certainly proper trials of stem cell, and I'm not talking about, the ones where they just do in a clinic. I'm talking about the trials, and to be sure that these are proper trials, they have to meet certain standards. And the standards are there to protect patients. So if you see a trial that is there's a website called clinicaltrials.gov. So proper trials are usually registered in there. So what trials need to do is to be sure that it is safe and it's not harmful, because at the end of the day, the stem cells is something that you're going to be infusing to your body, and our body, it likes to reject things that is foreign to it. And although the stem cells, they may come from an outside source or they may come from yourself, it's not that straightforward that it will definitely be safe. And the other thing is, in that context, you've got to make sure that it's not making things worse and it's not causing side effects that are not acceptable. And at the end of the day, you are putting cells back into your body, which has that environment that I showed you earlier about how, all the different factors that causes the nerve to degenerate to start with, you're putting that new cells back into that body. So there's no guarantees that that new cells is not also going to undergo the same process. So you've got to be sure that you've addressed all of this. So this is that's why a lot of stem cell trials have been negative, because they've not been able to actually show that stem cell therapy can cure or stop MND. So I think we just need to be clear about that. And, it's not that we're saying don't try it, but the evidence isn't there. And those who may not, look at the signs of this may want to give you that hope. And because it is incredibly expensive, I think it's important that, this is something that we address in this session. So other things, of course, there's supplements, all sorts of things that are out there that is not, the Rizol and the Adderable, not actually drug per se. So where can you learn more? And this is actually a very good website, okay? So it's run by this guy. One of the people that is involved in this is a guy called Richard Bedlack. And he is actually, some of our pals will know that he's the person that is actually running the trial, the study looking at ALS reversal, because, he has a group of patients, or identified a group of patients where, for whatever reason, they appear to have ALS, and for some reason they've reversed, to try and identify what is it about their situation that made them reverse. But he's also involved in this particular website. And it's a really good website, because basically it looks at all the off-label treatment, and it tells you, they look at all the data that's available and tell you, is it harmful? Is it okay? Is there any proof? And these are some of there are many, many, many more from there, but these are some of the things. So do go. I think it's much more comprehensive than this, okay? So let's focus now away from the drugs. What else we know just does help, okay? So we're now about what can we do to make you better, what in terms of your quality of life, and also prolonging life, should that be something, that patients want. So supporting your breathing muscles. So when breathing muscles are weak, less oxygen is available to you, and some of the negative, the carbon dioxide goes up, the toxic gases goes up. That makes you very tired very quickly. It makes you have less energy, your sleep is terrible, your appetite is poor, you get lots of chest infection because you cannot cough very well, you cannot get rid of the, the sputum, etc. So all of this, can you imagine, even for, the average person, if you don't have enough sleep, and we're now going through Ramadan here, so if if you're not eating, you get tired quite easily. So what we want to do is we want to try and support that breathing. So one of these things that we know does help is non-invasive ventilation. So this is a cartoon of it, which is very simplified. So essentially, it is equipment to improve your breathing without having to insert a tube into the breathing pipe, okay? And this has been shown on average to actually improve survival by 205 days. But more importantly, it also improves the quality of sleep and also your quality of life. So I think it's one of those treatments that, it's going to make you feel better. So in that sense, I think, it's something to be considered for sure. So the second thing is preventing weight loss. Okay, so that's also very important. And why is it that we lose, patients with MND lose weight? There's several factors. One of it is that, the muscles are starting to shrink. So you're losing muscle, and muscles are protein and they're quite heavy. So when you lose that, you will lose weight. And many patients also have problems with swallowing. They also maybe have loss of appetite. So as a result, they reduce, they stop eating, or the amount that they can eat is less. And the actual state of the illness causes you to use more energy. So all of that together makes you lose weight. So one of the focus is, when you lose weight, so that's the gray button here, a gray bar here compared to the black bar. And this suggests that it's significant. But even looking at the non-significant, those who have got, weight loss appears to do much less in terms of their mental state, their emotions, their functioning socially, feeling vibrant, general health, pain management, their physical ability and functioning. So we do know that with weight loss, you lose all of this, including your emotional and mental health as well. So how do we want to try and prevent the weight loss? So you'll find that, if we do try and track your weight closely, and at that stage, we do try to encourage you to have a high calorie diet. And doing that, if you just use high calorie diet on its own, it can maybe stabilize the weight to a certain extent. It can maybe further, although there will be further weight loss and maybe slight weight gain. But putting a feeding tube is one of the things that we know has been associated with increasing the gain, because it also bypasses your ability to swallow safely. So it allows you to have nutrition without worrying about the food going the wrong way, for instance. This is for patients where the problem starts, especially in the muscles of swallowing. So what is a feeding tube? So what do we do? It's, the idea is to help with your nutrition and to also protect your breathing, because when the swallowing is unsafe, it go the wrong way, and that will cause you to become more breathless, when your swallowing is weak. And ideally, we do want to try and do this earlier before you lose too much weight, and also when the breathing is not too bad. And just because, when we discuss about feeding tubes, just because we talk about the feeding tube, it doesn't mean that you can't still have things by mouth, but at least you won't have to try and catch up with the weight loss that you're experiencing. And the procedure is, I'm not here, I'm not a gastroenterologist, it's not done by myself, but we do have a team that does it. So they will put a camera like they would if you had a stomach problem. They'll shine a light, and from the outside, they will insert this tube, and that is what the feeding tube looks like. So that is from the nutrition aspect. And then there are symptoms that you might get as a result of the MND. And these are some of the things that can potentially help. So you might get spasm. So magnesium supplements can help with that. Excessive saliva. This can sometimes help the atropine drops, not always. Sometimes you might need to do a bit of suctioning. Stiffness and pain relief. So you can use baclofen if it's very stiff, and pain relief can be the usual pain pain relief. But sometimes I think you've had Prof. Lydia speak to you about the rehab side of things, sometimes doing some physical therapy. Some people like to do some massage, some acupuncture. All of these can actually sometimes help with the pain. And for patients who find that the mood is low, amitriptyline is something that we can use. We just have to be a bit cautious because it can make you a little bit sleepy. But one of the other good things about amitriptyline is that it can also help with the saliva as well. So the medical team, what we want to try and do, so from our perspective, we want to try and make an early assessment and early diagnosis, which is why I think raising awareness is really important. We try, if possible, to have a multi-team approach if we have the people to help us with this. And we try to see, is there any drug treatment that patients might want? What are the symptoms so that we can try and help to treat those? And when it reaches a stage that it's difficult to communicate, there are things that can help with communication. If the weight loss is a problem, how do we support this? If the breathing is a problem, how do we support it? And also discuss your wishes with both the family and yourself, of course. And throughout this, we want to try and respect the patient's choice. And it's always about what the patients want as opposed to what we want. We're just here really in a supportive measure, just really whilst we're trying to, find a cure for this. So I just wanted to share, my perspective or neurologist perspective. So first of all, on the diagnosis, I'm a neurologist, so I don't just see motor neuron disease, I see the whole spectrum of neurological disorders. And, but primarily I'm a doctor, and all of this, all of us that, went to medical school, we went to medical school to make people better, to try and improve things. So MND, unfortunately, is one of the diagnoses that many of us do not want to make that diagnosis. But we have to when we feel that that is the most likely diagnosis, because just kind of not addressing the issue is also, not right by the patients. They need to know what's going on. They need to know that there is something wrong. And even if there is no cure as yet, there are things that we hope we can help you to try and improve things for yourself. And we have a duty as well to patients to be honest when we explain to you. So I appreciate that sometimes, family members may not want us to say, what is going on, but it is our duty to be sure that patients know what's going on, that family know what's going on. But also we have to also understand where patients and family are coming from. So what we do is that, certainly what I try to do is yes, I will tell you that I think this is what's going on. I think this is motor neuron disease because it fits into the pattern that we see in MND. And we've excluded all the other possibilities. But how it's going to behave is something I cannot say for sure. So really, I hope that allows you to at least know that, to still try to be positive, because we don't know how bad it's going to be or how quickly things are going to get worse. And the lack of treatment is frustrating. I know it's so frustrating for patients, but we are also frustrated that we're not able to offer a cure. And I'll share with you also my frustration for not being able to secure clinical trials in Malaysia. But we have a duty to suggest treatments to you that have proof based on science. So there are a lot of high demand and use for all of this unproven alternative therapy, which is a bit of a problem, I find, especially in our health settings, because I can understand that patients are frustrated with us because we don't have anything to give, so they want to try all sorts of other things. But sometimes those treatments, and we're not saying don't take them because we don't know for sure. We can only advise you based on science. But you just have to be wary that, because some of them have got a lot of costs that you could actually use for other things that might make you feel better. So I think it's just something that is quite challenging sometimes, especially when we have a lot of alternative therapy out there, and that is something I noticed in the Asian context. It wasn't so much of an issue when I was working in the UK, where there's the the government is very, very strict, so you can't really have things that are not proven out there. Other things, so I wanted to share with you, because I have a lot of patients saying, when are we going to get these drugs? How can we be part of clinical trials? And, I shared this with the healthcare professionals earlier. Clinical trials, to me, there are two things. On my part, one of the things that we want to try and do is try and see how many patients there are in Malaysia, because what happens with clinical trials is that they need to have patient a setup where there are a lot of patients coming to the center, because not everybody will want to be part of a clinical trial. So that is why you are seeing most of them happening in high income countries like the US, the Europe. Those countries have got database, they've got registers of patients. So they have been, looking at these registers for many, 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 many years. So they have built up patients in the thousands. So when drug companies come, they want to see that there is somewhere where there are many patients, because different patients will need treatment at different stages. So that's one reason. The second reason, and unfortunately we can't get away from this, a lot of the trials are being done by drug companies. And at the end of the day, it is about who is going to be able to buy the drugs to start with. So that's another reason why it tends to be in the high income country. But from that perspective, if we do have clinical trials, you would be surprised. Not everybody is keen to join. And I think, and again, those of you who come to our clinic, because part of what we do is also research, because we are no longer just doctors treating patients. We also have a duty to learn more about the patients so that we can inform you better. So that's where research comes in. It is not about being guinea pigs or feeling like you're being tested. It is actually our way of finding out, building our own knowledge, especially in a disease where we don't know that much. And, in Malaysia, there's so little information. Whatever we've learned, we've actually learned from what we have, from our patients that have come to our clinic over the last 5 to 6 years. So, it is important that patients don't feel like they're being tested per se, because these have gone through ethical boards that make sure that we're protecting your rights. So it's, we always hope that you're willing to support. And because the more information we have, the more we understand. And when it comes to rare disease, certainly for us at we are building a collaboration with other people out there, the people in the high income countries who can support us, because it needs to be a big, we need to have patients coming from all different aspects, from different parts of the world, to really understand what's actually going on. So the search to find that treatment is really a global effort, especially when it's a relatively rare condition like MND. So here I just want to share with you, I had a conversation with a couple of our patients, which will remain unnamed here. But, I asked them, tell me what sort of things you want from me, for me to kind of like go through today, when you come to see me, what sort of things you want to know. So I think one of the things they said was, how can we connect with other patients? And I think MND Malaysia is one way you can do that. Sometimes through us as well. Some patients give permission for us to kind of like share their information with another patient if they're going through a procedure, for instance, or if they're going through having the machine, for instance. So you can also ask us, and if you know anybody can share that experience with us, we can do that. So you want to know where to get help for equipment and treatments to try. Certainly when it comes to NIV support and the eye tracker, I know MND Malaysia supports that. And for treatments to try, where possible at UMMC, we try, like for instance at Darabone, that's not registered in Malaysia, but one of our patients wanted to try it, so we will try and bring it across to deliver it to you on a named patient basis. That's something that we can do. Patient's perspective also, okay, to know that patients can have different experiences, as I've said, 2% with MND are not always the same. And then once diagnosed, what happens next? So as I've said before, it is very difficult to say for sure what can happen next. So it's important to stay focused and focus on what you can do, okay? So I think, that's part of our way of saying, don't sort of like kind of take things one step at a time, I think is the approach to this. And to know that the medical team will always be there to support, well, we definitely will try our best. And then one of the patients say, what is the point of seeing the doctors? We cannot make you feel better. And I completely understand that. And I must admit that there have been patients that have stopped coming to our clinic, and I hope that they are okay, whatever and wherever they are. But I think, yes, we can't we can't give you a cure. But it's important that we work together, because there are things that we can pick up that maybe you might not be able to pick up, and we can try and see how we can help you to at least cope. That's part of the reasons for having the multidisciplinary approach. And also there's some things that you're going through that we can try to see, and because we're also learning from patients as well. So then we get to also understand what's actually going on, because each patient is so different. And I can share with you that, like I mentioned earlier, so until about 13 years ago, I was working in the UK, so I was doing the MND clinic there, and it's a completely different experience. In the UK, everybody knows MND. And I think, we think part of that is probably Stephen Hawking, because he's such a prominent figure. And also it's the society there as well. Disability, attitude towards disability is much, very different to what it is in Asia. And I think here, certainly, not just the public, a lot of healthcare professionals also do not know about MND. And also, I think one of the patients said that, if they were going to go into a restaurant in a wheelchair, the perception from the public may not be so nice. They feel embarrassed. So that's the kind of attitude that is quite challenging here. And therefore, patients and also family prefer not to be in the public eye, and they prefer to hide their illness. And I think, this mindset needs to change, and only through us coming together can we actually try and do that. I know we may be, quite far away from what's happening in the US and what's happening in the UK or other places. When you see the TV, you see people, you see Stephen Hawking, for instance, he was completely disabled, but he was still functioning and living for a long time. And that is something that was acceptable to him. And I leave you with this quote by Stephen Hawking, because I can't maybe advise you at that level, but his advice to other disabled people would be to concentrate on things that your disability doesn't prevent you from doing well, and don't regret the things it interferes with. And so I think his philosophy was to not, physically you're already disabled, but don't be disabled in spirit. And certainly I think he was, representative of that. His mind was brilliant, so he continued to use that to so much good. And with that, I end my session today.